Hi everyone, my name is Dr. Moji Ario. I am here with my husband,
Umi Ario.
and we're going to talk to you about COVID. Yes. So, COVID-19, yes, it's not a hoax, it's not a myth. There is a lot of concerns. Mr. Adeshida Kunle, he told me, he said, you need to talk to us about COVID. So that's why we're here today.
Yes, and we totally understand that some people still don't believe that it's really happening. Yes, some people don't actually believe that it's true, that COVID is really out there. We see a lot of people falling ill here in the West also. And we have a few tips that we want to pass on to you.
So essentially, COVID-19, I think the reason why people don't think it's real is they don't know anyone who's gotten it. They themselves, they're not sick. They don't know anyone who's sick. But COVID-19 can cause a lot of symptoms and can be mistaken for a lot of things. Respiratory symptoms like cough, sore throat, sinus headache, body ache, fever, air pain, you name it, it can be COVID.
So, but all those symptoms that you just described sound like I have malaria, I have kata, I have cough. I mean, how will we know when I have cough? How will I know I don't have COVID? Or if it's malaria, how will I know it's not COVID?
Guess what? I'm not even done with those symptoms. You can have diarrhea, you can have stomach ache, you can have pain in your legs. Yes, it can mimic so many other things, but the one important thing to remember is when you have your cough, cold, kata symptoms or malaria symptoms, a lot of you go out, you get some treatments. You may try some home remedies, or you may go to the pharmacy and get anti-malaria, trying to treat for malaria, treating for typhoid, what have you. If you don't feel better after treating the usual remedies, using the usual remedies, chances are it may be COVID.
So what does that mean when I've treated for 2 days or 3 days using anti-malaria and I still have that fever, but already I've exposed my whole family to the disease? What does that mean?
That's why it's really important to be much more aware now that you can have something other than malaria. So what that means is if you're having your typical fever or body aches like in malaria, always think in the back of your head you might have COVID. That's just the reality we're faced today. So you need to self-isolate early, very early. What does self-isolate mean? You stay away from the rest of your family. If you have a room in particular that you can stay in, just you want to stay in that room, get your food, you eat your food there, stay there all the time. Try not to let any other family member come to you. If you are parents with young children, that's not the time you want your child to sleep in the bed with you. If you have a spouse and you may want to sleep in separate rooms for 14 days, you want to quarantine for 14 days, and that can help prevent spread to other family members. If possible, you can and should try to get a COVID test to confirm what your diagnosis is.
So, Dr. Ari, I think it might be sensible the minute that you have headache that you start wearing a mask, because if we wait 3-4 days and we're saying that maybe we're trained for malaria, but it might be COVID. So I think that it might make sense to start wearing your mask immediately you feel a little different. So even if it's not COVID, you would have protected the family members by wearing your mask from the onset. Does that make sense?
That may be helpful. Unfortunately, there's no proof that says that if the person is fully ill, that mask alone will protect the other family members, but it might reduce the burden. So that is a good idea. If you're feeling off, you're feeling achy, you're feeling sick, you can wear your mask. And he's saying even wear your mask in the home, not just when you go out. We'll talk about how and when to wear the mask, but that's a good way to possibly reduce exposure to other family members.
From the onset. Okay, but I think I've also heard that some people they call them, some people may not exhibit the symptoms of COVID and, and be just walking around. Well, can you tell us about those type of people?
That's right. There can be asymptomatic carriers is what these individuals are, which means they're not experiencing any symptoms of illness. They feel fine. They look like me and you're not sick. You have no fever, no headache, no sore throat, but they may actually have COVID, whether they had it before and they still have the virus, or they had exposure to the virus and now it's in their system and they're able to transmit it to someone else. That is what an asymptomatic carrier is. That's why it's really important to make sure that when you go out of your home, when you leave your own environment, you have your mask. You have to always have a mask to cover your nose and your mouth. You saw what I did? I didn't do this. Right?
You've
seen that?
People wear masks
right.
like that.
I didn't do this. Okay? This is not where you want to put the mask. It's important to cover both your nose and your mouth. Make sure you have a good seal. You pinch it at the top here, and there's no gap underneath. And you can still hear me, right? You can hear me. So when I'm doing a press conference,
yes,
I can still talk with my mask on.
Okay.
But
okay.
You had a question.
Yes, I do have a question.
Yes.
So when I have my mask on at work, can I take it off and put it on, take it off, move it up if I'm hot? What do you recommend?
Okay, I know that's a hard one, especially for people who have to wear masks all throughout the day, talking more than 4, 5, 6, 7, 8 hours. It might be uncomfortable. Ideally, you shouldn't take your mask off. Once it's on, it should stay on until you are completely clean and in an environment where it's just you and not too many people that you can be exposed to. But if you must take it off, there's a way to remove it safely and carefully. What you don't want to do is you don't want to touch the external portion of the mask. This side is where the virus is going to be touching, okay? Because as you inhale, as you breathe in, this is where the virus will get caught and stuck. It lands right on this side. So when you remove your mask, you always have to remove it by the air piece, and you just kind of remove it like this, close it together like this, and don't let this external portion touch your hands or your face. Ideally, you should wash the mask after one use, every single time you use it.
Okay, so you said if we take it off like that, like this, can I put it in my pocket or my purse, or if it's a woman inside the purse, like that? Ideally,
no. You really should, that's why you don't want to remove it until you are home, where you can put it to wash. But if you have to, just make sure that if you have some kind of tissue or another cloth, you can place it in that cloth and wrap it around that cloth, or a bag. I have this plastic bag that I sometimes use to secure my mask. I have several different type of masks depending on where I'm going to go and be exposed. This is for work in a hospital, and I'll explain that. But you can put your face mask in a container like this to make sure that you are not spreading any virus that may have been caught on the surface of the mask.
So I can use a nylon bag or anything, just put it inside and just knot it and tie it, basically,
right,
is what you're saying.
That is correct.
And when I get home and I want to take it out, you said I should open and, well, anyway, if I touch this now,
you're going to wash your
I
hands,
have to wash my
and
hands.
wash
Okay,
your mask.
So that's okay.
Right.
All right. Thank you.
Okay.
Yes.
And I was for healthcare workers, because I'm sure that Ms. Adeshita have a lot of healthcare worker friends. When you are in a hospital setting or a clinic where you may potentially be exposed to an actually sick person, you need more than just a Ankara fancy face mask, which can help, but with lower burden of virus. When the burden of the virus is higher, which means that person may definitely have COVID-19, you want to use an N95 mask. And what the difference is it's a special HEPA filter that has close to 99.9% protection against against the virus, which you can be exposed to. So extra protection is needed for healthcare workers. The government should please try to provide these to their medical residents that work in the federal medical centers, because if your residents and staff and the nurses get sick, there's going to be nobody else to take care of sick people. So please provide them with the appropriate mask, N95 masks.
So a question while you were talking about patients there. So how would you advise that we treat patients? Is everybody supposed to be handled as if they have COVID, or is it some people that we should treat as COVID? What is the best way to keep ourselves safe?
Very good question. That is interesting because in our environment, even in Nigeria and other parts of the world, people have that tendency to stigmatize. So we have to be careful, okay? COVID is not HIV, it's not some kind of death sentence. So even though healthcare workers have to be cautious as to how they treat their COVID suspect, person of interest, or a person under interest, PUI, they have to be careful to protect themselves. But that doesn't mean that you chase them away and say, oh, no, don't come here, you have COVID, or people around in the household, if there's someone who's sick, don't maltreat them. Don't just, there's somebody who has an acute illness that will get better if treated appropriately. You just need to take precautions, which means protect yourself with a mask, wash your hands. Healthcare workers have to wear gloves. They have to have personal protective equipment. That's that gown. They have to have a face shield for suspect cases, suspect persons, and treat them appropriately until they get better. And when people get better, they get better and they go home. They should not be stigmatized.
Yeah, but you said suspect cases. So does that mean when a doctor sees a patient, just a regular patient, he doesn't need to use a mask? Or
no, when a person comes, if you think about it, no one comes to the hospital that's healthy, right? They feel well. So when that person is coming because they are ill, you have to pretend or feel like it can be COVID until proven otherwise. So which means for every patient that you're seeing now coming into your clinic, to your hospital, you really need to be ready and protected, because potentially that can be a positive COVID patient. So with every patient that you see, unless it's a well check, but even with a well check, maybe a pregnant woman just delivered and she's coming in with her baby, you still should protect yourself in this pandemic period. Always just wear a mask and gloves, the least that you can do. Okay,
thank you. So let's talk about the regular things that occur in our society, like naming ceremonies, like funerals, like church. How do you suggest we manage a naming ceremony? This I'm talking about on the 7th day when we name a child. How should we handle that? How many people should be there? Should the people there wear masks? How many should the child wear a mask? These kind of things. Please tell us.
Okay, so I believe right now there's pretty much a ban on major gatherings and functions. But for smaller functions, maybe people are still doing their baby naming ceremonies. You really should minimize the number of people that attend very well. And I'm saying 10 people or less would be the ideal case. Anything over 10, it's really going to be difficult to perform physical distancing. We haven't talked about physical distancing yet, but essentially that is maintaining a distance of 6 feet, 3 meters. Okay, we use feet here in the U.S. in the West, but in Nigeria it's 3 meters, and that's a wide distance. So if you cannot keep people far apart, um, and also wearing their mask at this
ceremony.
function,
Okay.
please don't have the ceremony. Do it remotely. Do it on Zoom, or do it, with video, virtual attendance if possible. But it's just really important to protect the newborn and the mother, so that people coming from all over. You just want to keep it within the immediate family. But if you're inviting an officiating minister or an imam, they must be masked.
Okay.
And they should have their hands washed before starting the ceremony.
Can they carry the baby?
Ideally, I would say the baby and the baby should always stay with the mother, and let the officiating minister, reach out hands, lay hands over the child. You don't have to touch the child at this time of the pandemic. God will still bless the child, and God will bless the officiating minister as well.
Okay.
But let's protect the baby, let's protect the mother, and protect ourselves. Okay. So minimize, exposure. All other events, same thing for funerals. I know funerals you might not be able to postpone that, but it has to be a very, very small gathering. So immediate family only, fully masked, and also socially distanced, physically distanced, 3 meters apart. Okay.
Thank you. So again, talking about what we do daily, if we, of course, we go to the market, we have to haggle prices to buy yam, plantain, whatever we have to buy. How do you advise that people go about this kind of, because people have to eat, okay?
Right.
And then that's the market, and then you have people who have to take public transport to work, inside the bus or taxi, or even on Okada. How do you suggest that they handle these kind of situations?
That may be challenging, but at the same time, once again, if you wear your mask, I don't want you to have false sense of security, but that is better than doing nothing. So essentially, if you are in a bus or a taxi that has very small space, and they aren't, physically distancing yourself, because the bus driver wants to carry a full capacity load. Try to sit by the window and, with your mask on, turn your head away, and look out the window. Try not to just really breathe in that stagnant air that's, all of you sitting down, that you'll be exposed to. But at the same time, hopefully it's a short trip. If you can avoid long journeys at this time, avoid long trips. So a few minutes, 10, 20, 30 minutes in a bus with your face mask, you should be okay. Okada, I think there's a ban in Lagos, but in other places, people are still riding Okada. Maybe that's even slightly better right now, because it's just two of you, even though you're not socially distanced. You wear your mask, you turn your head to the side. I don't think that person's breath can come on you. So you should be able to travel safely with the Okada. Hand washing, I can't emphasize more than this. That's the main way to get rid of any virus that you may have been exposed to. Okay. So if you can, wherever you go, if let's say you get to your location, you left home and you are going to maybe the market, you might not be able to find a place to wash your hands. If you have hand sanitizer, you can use that while you are out and about. But once you get home, you want to wash your hands very well with soap and warm water. And the duration is very important too, not just wash 2 seconds and you're out. There's Mr. Ario actually taught my grandson about how to wash his hands. What was that you told him about?
He has to sing "Happy Birthday to You," the whole song, 2 times, and that should be. It makes a total length of about 30 seconds, I believe. So you sing "Happy Birthday to You," "Happy Birthday to You," "Happy Birthday to You," Happy birthday to you.
And wash
Wash
really
your hands
good.
very well.
So that gives you an estimated 20 seconds,
20 seconds, yeah.
as recommended by the WHO. 20 seconds of hand washing in hot water
Yes.
will get rid of any germs, COVID virus, flu virus, kata virus, anything that you may have been exposed to while you were outside. Another thing that we forgot to talk about, and you do this very well,
Yes.
is not touching your face. I don't know if you want to share that, how you protect yourself during flu season.
Yes. Usually, I don't get the cold. I always keep my hands like this. I don't rub my eyes. If I have to, I use my knuckle and I do something like that, or my shirt. And I usually keep my hands in my pocket. So these are some of the activities that you might want to incorporate into your life if you are a person who touches your face a lot. And I think we actually also need to talk about handling of your phone, because if you touch something and you touch your phone, of course your phone also will get a little contaminated. So there's also a suggestion that you should wipe your phone, wipe your glasses. All these high contact surfaces are places where we should try to clean periodically. I wash my glasses at least twice a day. I wipe my phone once a day. That's every morning, and that's that. Yes.
Yes. So these are called high touch items, but in your home and around you, you have other high touch areas. So the knob of the door, as you come in, everybody touches that if you think about it. Knobs of all doors, your bathroom door, your toilet door, your car door. So these are places periodically you want to wipe down very well. We talked about going maybe to the bank, or maybe
ATM.
we haven't mentioned it, but
Yes.
the ATM machine, you touch that. You may not be able to wipe that, but if you come, with your hand sanitizer, as soon as you are finished, taking out your money, withdrawing your money, make sure that you sanitize your hands, or if you have access to water right there, wash your hands as well. Yeah.
So you spoke about hot water. I mean, it's not common for us to have hot water unless you go and press the water heater, but it may not be common everywhere. So is it compulsory people use hot water? That's question one. Question two, what do you think about me carrying one sachet of I think we call it water sachet? Can I carry that around, or bottle water to wash my hand and put it in my bag or something like that and wash my hand even though I'm outside? I can put it in my car. I can have an extra in my bag, something like that. What do you think of those ideas?
That's a good idea. If you have a container or a bag or a vehicle that you put your stuff in when you're out and about, yes, you can have some sachet waters or bottled water plus soap. It's really important to have soap. If you don't have soap, don't waste your water. But have your soap and have water, so that at any point where you may have access to kind of wash your hands, you quickly just use the sachet water to wash your hands. And no, you don't have to have hot water when you're out and about. But when you get home, maybe it's a good idea to just boil some water, take a hot bath as well. Just wash everything down, and that will refresh you for the next day.
But not too hot.
I say hot, but maybe warm, or as you can tolerate.
Okay. What about when we go to banks? I know you were talking about the ATMs, and usually we have these, most of the time we have long queues. How do you recommend that people manage in that kind of situation?
We have to all cooperate. That's the most challenging areas, I would say, is physical distancing. And it's challenging for a lot of people. More so our people in Nigeria. We love to lean up against each other, especially when we are in a queue. But that's not good. You really need to keep some space between you and the person in front of you. Wear your mask. Don't let anybody come. If you have a little gap, you might not have a full 3 meters. Otherwise, 4 people will come and stand in there as if they didn't see you. But have a little gap so that you are not directly touching that person. But most importantly, have your mask on as well. Okay, so do your best. You guys, you can protect yourself if you are a little extra careful.
Okay. Thank you again. So let's talk about the symptoms of COVID itself.
I think we talked about
symptoms.
symptoms.
Spoke about that? Okay, I'm sorry. All right.
But was there any particular question that you had about any symptoms? Maybe we didn't touch on earlier?
Yes, I'm thinking of people who, because a common complaint is waist pain in Nigeria. If someone says they're having waist pain, and I know that one of the symptoms is back pain and chest pain or something like that, do you think waist pain can also manifest as a symptom of COVID?
COVID can manifest as anything, essentially, unfortunately. So that's what makes it difficult to, diagnose, So yes, if you're having back pain or waist pain or back or chest pain or body aches or pain, think, can this be COVID? But don't go crazy. I mean, don't go, don't get really overexcited. Just take precautions. At that juncture, you want to make sure that you hydrate yourself very well. If you're in pain, you can use a over-the-counter or something you got from the pharmacy, analgesia, to help relieve the pain. Rest well. Try to eat lots of fruits, which are rich in vitamin C. Vegetables are very good too, so eat lots of fruits and vegetables. And pineapples are really good, mangoes, oranges, lemons, just really load up on those. And rest very well. If you're coughing and you have catarrh and congestion, you can do something called a steam bath. My grandmother and my mother calls it lati degun. For you Yoruba people, you probably know that. It's a steam bath. You put some hot water in a steam and you put mentholated rub. So rub aboniki a tiny little bit.
Not aboniki.
Yes, you can use that. It's menthol.
That one is very strong.
The stronger the better. You're not putting it in your nostril. You're putting it in the water. And you're just going to use a towel to cover your head. You be careful. Make sure you have a good surface that's stable. And you just inhale that if you're having the respiratory symptoms. That may help relieve your symptoms and just clear any congestion that you have. And it's not just COVID, but it's good for any catarrh symptoms or any kind of respiratory symptoms that you might have. Is that good? That's answered your question?
That's good.
Okay.
So I'm sure everybody would like to know how, since we're preaching all this social distance and everything, why we're so close like this.
Right. So we are not maintaining physical distancing right now because we have been quarantined in the same household for at least 3 months. So you think about physical distancing when you don't know if that person next to you has COVID or not. I know some of you are saying, and didn't you say some people can be asymptomatic? Well, then we think of it this way. If we both have it, we're both asymptomatic, we're both quarantined in the same location. So we keep it here if we have it. If we don't have it, we keep ourselves clear from it and we don't get exposed to other people. So, but if we try not to have visitors at this time at all right now. But if you may have a visitor who does not live in the same household as yourself, guess what? They need to wear a mask and try to physical distance. So this is not the time you want to hug your friends or shake hands. You don't do that. But with your immediate household, whom you have been, under lockdown with or quarantined with for some time, you guys are fine. You can move around freely. I think we have covered a lot, and I think people are probably exhausted by now and probably want to go eat some dinner or eat or just watch something funny or something more interesting. But anyway, I hope everyone, try to maintain your safe space. Try to protect yourself from exposure. God will protect each and every one of us, because it's something that's going on all over the world. It's a pandemic, and what a pandemic means is that every single continent is involved, and this is unprecedented. It's never happened, I mean, to this extent ever in the history of the world. But not to be afraid. God is still in heaven, right? And he's still in charge of everything. So let's do our part and take precaution, and hopefully pray that this will end soon. Thank you very much for listening to our discussion. If you have any questions, you can, I think Mr. Adeshita might have some way to take questions. I'm not sure, but you can send him the messages. Okay?
Okay.
All right.
All right. Thank you very much for your time, and it was a pleasure presenting facts about COVID-19 to you this evening.
Have a good night.
Bye-bye.
Bye.
Thank you.